Hello everyone. My today's lecture will be on autonomic dysfunction. I have already talked about the anatomy and physiology of autonomic nervous system in my previous lectures. Now, as the name suggests, autonomic dysfunction means there is problem with the autonomic nervous system. Once a patient is having problem in his autonomic nervous system, the patient may present with varied symptoms. Now, let's talk about the symptoms of autonomic dysfunction. The patient may present with orthostatic intolerance or orthostatic hypotension. Means that when the patient stands up, the patient may feel dizzy or giddy. Even the patient may have syncope also. The patient may complain of dry eyes, dry mouth. There will be abnormal sweating. Abnormal sweating means there may be increased or decreased sweating, even absence of sweating. There are problem with bowel. There may be bowel incontinence, there may be constipation or diarrhea. There are problems with bladder. The patient may feel hesitancy during micturition. The patient may have problem with initiation of micturition. There may be bladder incontinence. There may be feeling of incomplete evacuation of bladder. There may be sexual dysfunction. In case of male, there may be problem in ejaculation, or there may be problem in erection or maintenance of erection. In cases of female, there may be reduced libido and there may be problem with orgasm. There may be history of exercise intolerance also. Now, let's see the causes of autonomic dysfunction or the diseases which are responsible for autonomic dysfunction. There are many diseases or many reasons which may result in autonomic dysfunction. Here I have listed a few common diseases which leads to autonomic dysfunction. Very commonly, diabetes mellitus leads to autonomic dysfunction. Then multisystem atrophy, Parkinson's disease, this may also lead to autonomic neuropathy. Amyloidosis, which is the disease of building up of abnormal protein in our body, can lead to autonomic dysfunction. Porphyria can lead to autonomic dysfunction. Hypothyroidism can lead to autonomic dysfunction, and cancer also can lead to autonomic dysfunction. There are drugs, anti-cancer drugs, which can also lead to autonomic dysfunction. Now, how do we treat a case of autonomic dysfunction? Very importantly, if we can identify or if we can diagnose the disease which is leading to autonomic dysfunction, we can treat the disease. So, treatment of underlying cause or the underlying disease process is very much important. Next, for treatment of orthostatic hypotension, there are some lifestyle modifications which we can ask the patient. Okay, we can ask the patient to increase the fluid intake. We can ask the patient to add salt to his diet. This is one of the conditions where we ask the patient to increase the intake of salt in his diet. We can ask the patient that when the patient is changing his or her position, patient should not hurriedly do that. Slowly, patient should change his position. Suppose someone is lying down and he wants to stand up, then he should do it slowly, not suddenly. Then there are drugs, for example, midodrine also can be used to treat orthostatic hypotension or orthostatic intolerance. The patient should be maintaining a healthy weight, and we should ask the patient to avoid smoking or avoid alcohol. So these are the treatments which we can do in a patient of autonomic dysfunction. Okay, now I'm going to discuss about the tests for autonomic function. Okay, the test for autonomic function can be subdivided into three categories. First, test for cardiovagal innervation or parasympathetic innervation. Okay, to see the integrity of cardiovagal innervation, we can do the following test. First of all, we can see the heart rate response to deep breathing. In this, we will ask the patient to take deep breath, 6 deep breaths per minute for 3 cycles. And we will take the average of the difference of maximum and minimum heart rate. Again, I am repeating, we will ask the patient to take deep breath, 6 deep breaths per minute. Patient will repeat the cycle for 3 cycles and we will take the average of difference of maximum and minimum heart rate. Normally, the difference is more than 15, but if the difference is less than 10, it is abnormal. And in between 10 to 15, it is borderline. Next test is Valsalva Ratio. Okay, we can ask the patient to do a Valsalva maneuver and we can take the maximum heart rate and minimum heart rate. Valsalva Ratio is the ratio of the maximum and minimum heart rate. This also indicates autonomic dysfunction or cardiovagal dysfunction with the cardiovagal innervation. The third thing which we can do is heart rate response to standing. Normally, when a person stands, the heart rate increases by 10 to 20 beats per minute. That is a reflex mechanism. But if the heart rate is not increasing by 10 to 20 beats per minute, that means there is autonomic dysfunction. In this, we can take a 30 and 15 ratio. That means the ratio of RR interval at beat 30 and RR interval at beat 15. If the ratio is less than 1, that means it is abnormal. That means there is chance of having autonomic dysfunction. The normal ratio is 1.04. Okay, and in between 1 to 1.04, the result is considered as borderline. Now, next category of test is test for adrenergic functions. To know the integrity of adrenergic functions, we can do the following tests. Beat to beat blood pressure recordings in Valsalva. That means during the Valsalva maneuver, we have to record blood pressure. Beat to beat recording of blood pressure can be done. This is done in specialized laboratories. Okay. Next is sustained hand grip. We can ask the patient to do a sustained hand grip with the help of a dynamometer, and we should be checking the blood pressure in the other arm. Okay, if the diastolic blood pressure is more than 15 millimeter of mercury, that means it is a normal response. Next, what we can do is that cold pressure test. In this, we should ask the patient to immerse his or her hand or one of the limb in cold water, and then we can measure the diastolic blood pressure. If the diastolic blood pressure increases by 15 millimeter of mercury, that means it is normal. We can also do tilt table testing, head up tilt table testing. This is also done in laboratories. The third category is test for pseudomotor function. Okay. Under this category, we can do the following test. First is Qsart or Qsart, Quantitative Pseudomotor Exon Reflex Test. This test is done to see the integrity of post-ganglionic pseudomotor function. In this test, the response is recorded from 1 skin site in the upper limb and 3 skin site from the lower limbs, and the response is measured. Okay. The next thing what we can do is thermoregulatory sweat test. It will help to know the distribution of abnormal sweating. In this test, we will keep the patient at a particular temperature and a particular humidity, and then an indicator powder is applied over the patient's body. When there is sweating, the indicator powder changes its color, and in this way we can know the distribution of abnormal sweating. The next test what we can do is sympathetic skin response. Okay, but this is not a very specific or not very sensitive test. The other test what we can do is sweat imprint. In this sweat imprint test, we can actually identify the density of sweat glands. We can visualize the sweat droplet size. We can also measure the secretion of sweat over a period of fixed time. Over a fixed period, we can measure the sweat secretion, and in this way we can know if there is any abnormal sweating, abnormal pseudomotor function or not. So these are few tests which we can do either at the bedside, or some tests can be done in the specialized laboratories to identify the autonomic dysfunction. There are many other tests also, but I have discussed the tests which are easily available or we can do easily at bedside. Thank you.